There are three conditions that can damage the radial nerve. This is at the axilla. This would be compression by the crutches, or when the patient after a party has been sleeping on the chair with the arm hanging on the dorsum of the chair. The other is a mid-shaft fracture of the humerus. Here the proximal segment would be anterolaterally displaced, and there could also be bleeding from the deep brachial artery that accompanies the radial nerve on the mid-shaft fracture. Or the other is when the patient has a job that produces a lot of supination pronation. This movement can damage the radial nerve as it is passing through the forearm on the head of the pronator. There is here the patient in all the lesions of the radial nerve would have just inability to extend usually the fingers, and depending on which level is which other parts are affected. For example, damage here at the axilla, there would be inability to extend the elbow, the wrist, the fingers, etc. And loss of sensation on this part that is innervated by the radial nerve. The damage of the nerve at the pronator teres level in the screws that are using supination and pronation movements all the time. The damage here is just to the deep radial branch, so there is sparing of the triceps and of the sensitive branches. The radial nerve is formed by all the roots of the brachial plexus, that is from C5 to T1, and is one of the most common nerve damage of the brachial plexus.